Okay. Good morning or good evening or afternoon, wherever you are. Um, Please, before I start, if you could make sure that your audio is on mute, that'd be very helpful. If you have any questions, as we're going through, I'm actually going to try to get through two cases. But if you have any questions as we're going through, just either type in the question in the chat or there's a Q&A section, or you can just use your audio. Okay. So since we're recording and it's 7:03, we will get started. All right. So I'm just going to go back and forth between the PowerPoints to kind of outline the cases and what we're doing. And then I'm going to go to the RadarOpus to show you how to navigate and how to get to the symptoms that helped to solve the case. So this was the first case. This is actually Um, this was my sister's case that I took years and years ago. I think it was 2014. I'll just give you a little bit of history. She incurred brain damage when she was really small, and so she never learned to walk. She never learned to talk. She never learned to use the bathroom or feed herself. And so she would be fed by spoon up until about, I think, 2006 or 2007. She started choking on food and aspirating sometimes, and she ended up in the hospital once or twice with aspiration pneumonia. And this was, I think, the third time, and I believe this was somewhere around 2014. So the other thing is she's got really severe scoliosis. So her body twists or bends towards the left. So on the left side of the body, you've got an upper and a lower, you've got two lobes of the lung. On the right side, you've got three lobes. You've got two lobes on the left because the heart's there. So anyway, with the scoliosis and the G tube, which she'd been being fed through for a couple of years, if she does aspirate, when she's, in this case, it was because of vomiting secondary to the second bullet point here. The neurologist had changed an anticonvulsant med, and one of the side effects was vomiting. So I think that's kind of where how the aspiration pneumonia started. So we're just going to kind of go through these symptoms here. I noticed for over about a week and a half, 2-week period, she kind of had this very weak cough. And so we'll kind of go through these. What I'm going to do, I'm going to go through these symptoms, and then I'm going to ask you for suggestions for repertorizing. And I have things that we could repertorize that will definitely get us to the remedy and the rubrics that I used. And then, because you can look at this and make suggestions or guesses about remedies, but then you also have to do a differential on which remedy fits the best. And then I'll kind of go through what happened after taking the remedy, and then we'll go to the second case. So let's see. So it was a very weak cough, and the cough was weak. It actually compelled both my parents to talk, even though she's nonverbal. They would say, cough a little bit harder, cough a little bit harder, because you could kind of tell that there was mucus, phlegm, expectoration, kind of in the trachea and in the bronchi and the back of the throat. And she doesn't have the cognitive ability. Oh, I should cough harder. But as it presented, it was just a weak cough, and it went on for about 2 weeks. There was rattling in the upper chest with respiration, not necessarily with the cough. The cough was just very short and very weak. She does have an issue that's with regard to either pale lips, pale skin. When she is having trouble, even these days, with respiration, they have a pulse oximeter that they check, and if it drops below 90, my parents act accordingly. So anyway, pale lips and face, her eyes. There have been several times when she gets sick, where her eyes will get very sunken, which is actually a good symptom that you can use if you have a patient and the eyes sink in or the face looks sunken. You can either use eyes sunken or face sunken. Very sleepy, lots of yawning, and weak for the last 2 weeks. So the observations, weak, pale, moaning, sleepiness, and her pulse was weak and rapid. Um, so this was a Tuesday. I believe it was in maybe March, and they had changed the medication, the anticonvulsant medication in January. Um, and so on that Tuesday, um, I recommended the remedy that we're going to get to, and they wanted to start an antibiotic. The problem was when they put the antibiotic into the G tube, after about 20 minutes, she would vomit because she was still having issues with the change in the anticonvulsant medication. So the antibiotic that they ended up putting her on had nothing to do with the fact that within 3 days, she was doing much better. Um, so that was Tuesday, we started the remedy. They did a blood draw, and I'll get into that. Um, and then the following morning, Wednesday morning, an X-ray tech came to the house and did a chest X-ray, and sure enough, her lower left lobe was completely consolidated. So on an X-ray, if the lungs are clear, they look mostly black, and if there's any consolidation or tumors or anything that's obstructing the X-ray, it'll turn up white. So her lower left lobe was completely consolidated. Okay, we'll repertorize that as well. Um, her blood count. When they did the blood count, she had a white cell count, which are neutrophils of 28,000, and she had a left shift. So what that means is there's an acute infection, and typically with a bacterial infection, the neutrophils go into the bloodstream and they go to wherever the infection is. And if it's a very severe infection, the body will put all the mature neutrophils that are in waiting out because of the infection, and then you'll get something called a left shift, which are immature neutrophils that are being put into the bloodstream. And so when you see on a white blood cell count, um, a high neutrophil count, you know, normal is usually around 7 to 10,000. This is 20, 28, 29,000 with a left shift, meaning it's a strong indication of a very severe infection. So we had that. We've got the consolidation of the lower left lobe, and we've got the cough, and we've got a history of the pneumonia. So the medical doctor who was overseeing her allopathic medical care diagnosed it as bacterial pneumonia. So with all of this here, these are essentially the rubrics that I repertorized, or the symptoms that I repertorized. Um, Anybody want to make any recommendations or suggestions as far as, and I'm going to jump over here to actual radar. And as I said in the description for this presentation, we're going to use Pulford's repertory. This is a repertory of pneumonia by Pulford. So there were two Pulfords, a father and a son. And there was a historian that went back and looked at their records. And between them, they had decades and decades of clinical experience. And somebody went back and looked through their records, and they found that they had over 3,000 cases of diagnosed pneumonia over the span of both of their medical careers. And they looked at the outcomes of these, I think it was 3,100 something cases. And they looked at the outcome of these. They had a 0.17% mortality rate, which means 99.83% of the time the patient survived. And this is pneumonia before antibiotics. I mean, even today, with antibiotics, there's about a 95% survival rate. So homeopathy was really doing a stellar job in the hands of these absolute experts. So if you are inclined to take cases that have to, involve the lungs, pneumonia, infections, you want to reference and be able to use Pulford's repertory of pneumonia. So we'll use that. So if anybody has any recommendations for symptoms they'd like to repertorize, if not, I'll just kind of go through the repertorization of the case. One of the first things you want to look at is under the mind chapter, I believe it was. Question. Yeah, lung consolidation. That's a good one. So the way we would do that is we go to the search function. Let me slow down a little bit. Let me just get rid of this as a search I was doing earlier. So the search function is up here, and there's a little caret that points down, and you click on that, and then you go to advanced search right here. Okay. So give me 1 second. Let me just go to Adonis. And so just so you know where to find pneumonia and how it's repertory, the repertory language. So I'm just going to type, if you want to, because I have this window open, all I need to do is type to get to any chapter I want. So I'm going to type in the lungs are in the chest. So I go to chest, press enter, and I type in inflammation. And there's inflammation. I can click on that. And then you'll see right here, lungs. And I can press enter. So that's pneumonitis or pneumonia, pulmonitis, and there's a little blue flag there, so you can click on that. It just tells you it's pneumonia or pneumonitis. This is the rubric. So if you go around looking for pneumonia, you're not going to find it. It's chest inflammation of the lungs. Okay, and if I go to the binoculars here and I click on that, these are all your chapters. So I essentially I can just type in CHE and get you to the chest. I press enter, and then inflammation. If I type in consolidation, it's not there, right? So we can go to the search function. Again, the search is up here. I go to advanced search, and I can type in okay. And I want to search. So I'm telling the computer I want to find this word, and I want to find it in all repertories. Because we're repertorizing right now. You could also look in documents so here in Adonis, you've got chest, inflammation, lungs, COVID-19 during consolidation. This isn't COVID-19, so we're not going to use that. Go to Murphy. Clinical pneumonia, infection, inflammation, lung stage pneumonia, consolidation. Consolidation typically happens after hepatization. So, and then there's if you all know, Murphy has a clinical chapter where you can look up just different clinical diagnoses. So we can take that and put that in there. So what we're doing here is we're kind of looking at the pathology, right? This isn't a modality. This isn't a concomitant. This is part of the natural progression of bacterial pneumonia. So we can't put all our eggs in one basket here with this particular symptom because it's unique to the disease, but it's not unique to any particular one remedy. But there are going to be a handful of remedies in there that are very, very commonly used for pneumonia based on the totality of the symptoms. So we can combine these two. So good, that was a good recommendation. The other thing, I'm just going to kind of go, we talked about the eyes being sunken. So I'm just going to type in the word sunken. And I'm going to just go to all repertories. And we're going to go to Pulford. Eyes sunken, there's 15 there. So I'm just going to grab them with my mouse. I'm going to grab this and pull it up into this clipboard. And then I'm going to go to Schroyen's Adonis. And there's sinking, head, eyes, sunken, 157. That's huge. So we're going to take that. It's a big rubric, but again, these are just observations. We're kind of building out the case. This is a cured case, so we can also talk about which symptoms, if you had to pick 2 or 3 symptoms to use as eliminative, right? Which ones would we use? The other thing was there was I'll go to this one last because this is actually a good rubric. There was paleness of the face and the lips. So we go to face, discoloration, pale, and then the lips. So we're going to take that and put that in the clipboard. and tail. Face is going to have a coloration. So there's 300 anemic, ghastly, 377 remedies. That's big. We'll just put it in there, but any rubric with over 120 to 180 remedies, it starts to become so big it's no longer specific, but you can use it kind of as a confirmatory. Worse from antibiotics. Um, so she wasn't on the antibiotics long enough, and it wasn't the antibiotics that were making her vomit. It was the anticonvulsant medication that triggered the vomiting, that triggered the aspiration pneumonia. I wouldn't use that in this case. There are a couple of other things that I would use. The fact that she was making noises, that she was moaning. So we can put in moaning. I use that a lot. She didn't have a fever, but if I have a lot of pediatric cases and when the fever starts, there's a lot of moaning, I like to use that rubric. Main remedy there for moaning during fever is pulsatilla. It's a grade 3. So we're going to go to Pulford, moaning, groaning, etc. 13 remedies. Pull that in there. Then you go to Shroyan. And of course, you understand that this is synthesis. Synthesis means that they're bringing a bunch of different repertories together. So the rubric's going to be a lot bigger and a lot more comprehensive. So you can see moaning in children, constant. There's during fever, which is probably heat, during heat. There's 23 remedies there. See, pulsatilla is number 1 as a grade 3, but you can't discount any of these other remedies. But she did not have a fever. Her vitality is relatively low. So we'll just take moaning here and put that in there. Let's see, what else did we use? So the rattling during respiration, we want to look at that, okay? And if any of you who are here in attendance know anything about the remedies we use for respiratory issues, you probably know the remedy. So this isn't about finding small, unique remedies that are exciting and this and that. All the remedies are exciting to me. The most exciting thing is the response when you get the right remedy. So rattling, and it's not during the cough, so it's not a rattling cough. I just want to show you here. If we go down, larynx rattling, respiration rattling. That's what we're going to use, respiration rattling. And then down further, respiration rattling with old people. There's a Kunze note. Cough rattling. That's not what we're going to use. We use a rattling cough when the person coughed and you hear a rattle in the throat, larynx, trachea, bronchi, chest area. But in this case, it was a weak cough with rattling respiration. So respiration rattling, and here's Pulford, respiration rattling. So we're going to kind of go through, I'm going to show, even though the rubrics in Pulford are smaller, this is just a repertory for pneumonia, so they're quite reliable. I just want to point that out. There's also a rubric, so nothing was being coughed up, very weak cough, right? So there's a very unique rubric for aspiration rattling, right? What do we call what comes out of the lungs? Because we have to differentiate, is it something, because the mucosa, right, it creates a discharge. Yeah, expectoration or sputum, correct. So in this case, expectoration, and I believe this is Dr. Margaret Tyler's rubric. So look in all repertories. Rattling expectoration without expectoration. So there's scanty, which is very small amounts, or without. Expectoration scanty. So it's not scanty, it's expectorant. It's rattling, respiration without. Meaning when they cough, nothing comes up and nothing comes out. Okay. So you see how that gets more unique. That points more to the remedy, because if somebody has mucus, right, in the bronchi, in the trachea, in the lungs, there's when they cough, right? That's what a cough is. A cough is a physiologic response to irritation or something in the airway. And the cough is designed to get whatever's irritating or obstructing the airway out. So if there's rattling, you can assume there's some degree of obstruction that's causing the noise, the rattling noise, or if you're auscultating, you'll hear it. So what makes this unique is that there's rattling, but when they go to cough, nothing comes up. And there can be multiple reasons for that. It can be weakness. It can be the expectoration itself is very tenacious and sticky, and it's sticking to the mucosa, which is, but then there's other rubrics for difficult dislodging of mucus. So this is a good rubric here. So out. Let me put that one in there. There's another one that I want to put in here. It's very unique. Sleepiness. And this symptom here is most pathognomonic for this particular remedy. You have somebody that's yawning a lot, very sleepy, with a cough, regardless of whether it's bronchitis or pneumonia. This is a very strong indication for this remedy. So here's cough in the morning, evening, sleep. So these are all the rubrics. We have a relationship between cough and sleep. And in this case, we can look at Pulford. And sleepiness, cough during. So we can put that in there. And you're also going to find that in synthesis as well. It's going to be under sleep. So we just kind of scroll down. These are actually really good rubrics here. If typically when I take a case where a cough is involved, I'll ask, does the cough prevent the sleep? Does it disturb the sleep? Does it wake the person up? Does it happen after they fall asleep? There's preventing sleep. And you see all of these during sleep, preventing sleep, waking from sleep. They all have Kunzli dots, Kunzli notes. So they're very reliable. Suffocative during cough. There it is. Sleepiness with cough. Double click on that. And bring that up into our clipboard. The other thing, I just wanted to share this with you. This is a good rubric. I've used this a couple times over the years. Does anybody know what it's called when pneumonia's been allowed to go on? Not more than a couple days, a week, 2 weeks, 3 weeks. There's a particular word that we want to look for if the cough has been something. I'll give you guys a second or two to type in. So the word we're looking for is neglected. So I'm just going to type in neglected, go to all repertories, get out of the mind chapter. We can go to Pulford here. He's going to have it. Pneumonia neglected. So this is any case where the person has gone weeks, couple weeks or more. And so the pneumonia just it's been allowed to progress, through the early stages of hepatization into consolidation. And so we call this neglected pneumonia. Put that in there. And then we go to Schwein. Get through the mind chapter, chest, inflammation, bronchi, lungs, neglected. Inflammation. So remember, chest, inflammation, lungs is pneumonia, neglected. So there you've got 33 remedies. So we can pull that up there. Did we pull in the clinical pneumonia stages consolidation? I think we did, right? There's another rubric I want to use. Weak cough. Right, that's what it was. That's how we would describe the cough, this particular cough. So Schleim, cough accompanied by weakness in your chest. This is another good thing about radar. If you don't get to the right rubric, these little blue links will take you to where you actually need to be. So double click on that. Chest weakness. That's the question. Pulse weak. Yeah, I actually did in this case, I did feel the pulse. And let me check real quick. We can go to pulse. Pulse is in the, just so everybody knows, pulse is in the generals. We can go to generals. Pulse. Not pulsations, pulse. Weak. Accompanied by. What is it? So it's not where I was expecting it to be. Pulse. So you search for words here. You can put words together. You can either search each one of these individually, which will bring up a couple thousand rubrics, or all words in the same paragraph meaning in the same. So if it's in the materia medica, it's going to look in the same paragraph. If it's in the repertory, it's going to look in the same rubric. So let's do a search there in all repertories. Pulse, weak in cough, and there's the remedy. So you do want to feel the pulse in acute cases. Everything, right? Symptoms are what the patient reports. Signs are what you can are what you can observe or feel. The next case we have will also be through auscultation and percussion. We'll get some symptoms. Let me just see what nerve says here. Pulse, weak, feeble, in cough. And you'll see that's where Murphy got his. So we see here Murphy's repertory, and he says that he's the author of that. Well, nerve is actually where he got that from. And I'm sure he probably confirmed it, but let me see. We did the neglected rubric. There's a weakness of the lungs. So if I want to jump around to different repertories, this downward caret right here, I click on that. I want to go back to Adonis, and then it's chest, back, weakness of the lungs, accompanied by cough. And there's antimonium tartaricum, and there is Margaret Tyler. That's the rubric I was actually looking for. So Tyler and Nur have both confirmed that there's weakness of the pulse and weakness of the lungs. Okay. If you want to know who the author is, you see TL and you go, oh, who's that? Just double click on it. And then see Dr. Margaret Tyler. She's very reliable. Let me see. Sleepiness with cough, we covered that. Pulse weak. We covered that. Respiration rattling. Face pale. Oh, the last one I wanted to share with you. Type in the word expulsion. Chest, expulsive power, lungs, wanted. So there's Clark, there's Margaret Tyler again. So what are they saying here? This is expulsive power, meaning there is mucus, right, in the lungs, in the airways, and the ability of the cough of the person, of the physiology. They're so weak, they don't have the power to expel uh, the mucus from the airways. So that's what this means here. So of course, when we go and look at the clipboard, I just clicked on it once here. Let me just open this up a little. So all these tabs, if I double click here on this, you see how it takes up kind of half. If I double click here, it opens it up more. You just have a bigger picture. And I'm just grabbing this and opening this up a little bit. So clinical pneumonia, late stages. What I can do, I can click on this and then hold the command button and click on this. And then I can group, because they say the same thing essentially. And I want to create a new symptom combining the remedies of the selected rubrics combined. And then it takes from the top and it brings it down here to the bottom. So what do we have here? We've got antimonium tartaricum, we've got phosphorus, sulfur, ipecac, sepia, and they all have different energies. We can do the same thing with the eyes here. You see Pulford, there are 15 remedies. Antimonium tartaricum is a grade 3. It's a grade 3 here as well, but there's so many more remedies. Pale lips, pale face, antimonium tartaricum is a grade 3. Moaning and groaning. Respiration, rattling. In Pulford, it's a grade 3 along with phosphorus, ipecac, lycopodium, arsenicum. This is a unique rubric here, right? Respiration, rattling without expectoration. Antimonium tartaricum is a grade 3. Sleepiness with cough, 2 remedies there. Sleepiness with cough, this was Pulford, and this was Adonis. So we can combine those. Group. And again, I'll bring it to the top. It'll put a little asterisk so that you know that the rubric you're looking at is a combination of multiple. You can combine as many rubrics as you'd like with that method. It's not under pneumonia neglected. There, let me. So if I want to check, I go here to ANT tartaricum, enter, and I'll type in neglected. And I want to search in all repertories. I could search in all documents as well to see if it's in the materia medica. So Schroyen, chest inflammation, lungs neglected, Oscar Boricke, it's a grade 2. There's Boricke. This is where synthesis got that entry right there. Okay. Respiration, lungs, pneumonia type, neglected, lingering cases. So you think of neglected or lingering cases. He's got 15 remedies here, carbo-veg, which with antimonium tart, you definitely want to do a differential of remedies, lycopodium for sure. Does anybody know what antimonium tartaricum and lycopodium? It's a sign that you'll see on the face that lycopodium and antimonium tartaricum share together. It's a strongly indicated sign when you have asthma, and you'll see it somewhere on the face in an asthmatic case. It's a symptom that they both share. Anybody want to take a guess? What do they know? So neglected, Murphy's got. No, it's not stupor. So this will be actually be good. If I type in the word fan, just go to repertory. It's fan-like motion of the alae nasi, the wings of the nose. Nose motion, wings, fan-like. So you see here, there's antimonium tartaricum, ammoniacum gloomy, bromium, lycopodium strongly indicated. And then when you see respiration asthmatic accompanied by constant motion of the wings of the nose, these are the alae nasi here, the outside of the nose. So the sign is that the alae nasi, the wings of the nose, are going back and forth like a fan. If you see that, this is the rubric you want to use if it's asthma. Okay, you've got lycopodium and ammoniacum gloomy. Let me just go back. So, but this is a very, very good rubric. Okay, it's under nose, motion, wings of the alae nasi, flapping wings, constant fan-like motion. Very, very good. It's one of the accessory muscles. What it indicates is that the person is having difficulty with respiration, like abdominal breathing. There's when they say somebody's using accessory muscles to breathe, it's just an indication that the diaphragm and the other muscles that are normally used for normal respiration are being taxed. They have to do the body has to do something else in order to pull in enough air to get enough oxygen. So the other one is respiration, abdominal. And you'll see antimonium tartaricum is a grade 3 here as well. So that's if the person's using you'll see that they're using their abdominal muscles just to breathe. And these would be pretty severe cases that they've used if you see this abdominal breathing. Okay. Lungs neglected, inflammation neglected or lingering cases, pneumonia lingering. So those are the rubrics. That was the remedy. So let's jump back here. So this is how it was dosed. Antimonium tartaricum, 12C in liquid, 3 drops every 4 hours. So they started Tuesday afternoon, got 2 doses, one around, I think, 3 or 4 o'clock in the afternoon, another one before bed. And the next morning, a 3rd dose, and then the chest x-ray. And then something happened that afternoon that I wasn't told about until several days later. So what happened? Let's go down here. So the following day after the 3rd dose, so this is the afternoon, after the chest x-ray, she coughed up a large brownish red ball of mucus. So we went from weak rattling, very weak cough to about 24 hours after starting the remedy, a very forceful, violent cough that coughed up a brownish red ball, which we can assume was mucus and probably some blood and bacteria. And so that happened Wednesday afternoon. I wasn't told about it. Thursday was pretty uneventful. Thursday, late night, I think almost into Friday morning actually was, probably I think 3 or 4 in the morning, she threw up again. And then that's when my parents took her up to the hospital in Portland. And so what do? They want to see where she is. So they drew some blood and they did another x-ray. So this was less than 72 hours after she started the remedy, because this is early morning Friday. Blood work and chest x-ray were repeated and found to be normal, completely normal. Her white cell count, I think, was like 8,000. Chest x-ray completely clear. And then the medical doctor said that she had misdiagnosed the pneumonia, because, as you know, in a bacterial pneumonia case, if somebody just does antibiotics, they typically takes 2, 3, 4 days to start feeling better, and it takes a couple of weeks, a week at the shortest, a week, up to 2 weeks to really start to see improvement to the point where you say, okay, the person's out of the woods, they're going to get resolution. So to have that in less than 3 days was out of the realm of possibility for the medical doctor. And so she just said that she had misdiagnosed. Okay, so that was case number 1. Oh, do a different look. So you've got to do a differential. I mean, it's clear the remedy is here, but you don't know it's a curative remedy until the vital force gives you the stamp of approval, right? You're never 100% sure until you give the remedy and what is the response of the vital force. And what else does this illustrate here? This illustrates that homeopathy it's not antibacterial. There's nothing in the remedy in that 12C, right, that's going to kill the bacteria in the lungs. So how do we get cure? Well, the reason the lungs are the way they are, the reason there's that degree of inflammation, is because there's a derangement in the vital force. It's right. What we're seeing as far as signs and symptoms is a shadow of the derangement of the energetic aspect of the patient. So when we correct the energetic aspect, that corrects the physiology, and the physiology being corrected allows the immune system to do its work. And in doing that, the physiology returns to a state of normalcy, and the inflammation goes away. When the inflammation goes away, there's no need for the bacteria to be there anymore. So you want to I would do a differential on the remedy Seneca. Um, let me just as an exercise, let me show you. So we go to search, we've got antimonium tartaricum, we've got Seneca, let's see, and I'm going to show you, I want to go to remedies, and then I want to go to symptoms with all of these remedies. So essentially what the repertory is going to do is it's going to pull out every single rubric with antimonium tartaricum and Seneca in it. So we can do that for the entire repertory, or if you want, you can just look in the chest chapter. So I'm typing in chest, I click on all caps. Let's say I want to look in the generals chapter. And let's say I want to look in respiration, and cough. Right? So these are all the chapters that would cover essentially an airway case. So that what I'm setting the computer up to do is to look for antimonium and Seneca, those two remedies. So any rubric that has both of those remedies and all of these 4 chapters. So then I want to send it to do that in all repertories. We have 365 rubrics in synthesis. Pulford's got 78. I'm just looking Pulford real quick. Respiration accelerated, difficult at night, difficult while lying. See, these are good rubrics because it gives you a symptom with a modality attached. Lying impossible, worse while lying, respiration rattling. They're both, why are they rattling? Because there's a lot of mucus in both of these cases, typically. Cough, dry in the evening, loose in the morning. This is actually a very good rubric to use. So you can kind of go through that. Must sit up. This is actually a very good rubric. Emphysema, palpitations, weakness. Let me just go to Adonis real quick. Respiration, asthmatic from accumulation of mucus. Let me just show you. Let me just type in the word mucus. So I want to see all of the rubrics with those 2 remedies and the word mucus in the rubric. 24. Discharge mucus, mouth mucus, collection of mucus on the tongue. Right? This is why it's important if you can, if you run your practice this way, where you can do clinical physical diagnosis, where you can look in the mouth and look in the eyes and look in the ears and listen to the heart. The larynx, mucus in the air passages. Seneca is a grade 3, antimonium tart is a 1. In the larynx, and you switch it around, antimonium's a grade 3, Seneca's a grade 2. Asthmatic from accumulation of mucus, they're both there. Chest, respiration impeded, obstructed, which means it's being blocked from mucus in the airways or the chest. Expectorate, there's the word tenacious, meaning the mucus is very sticky and it sticks to the mucosa, so it's hard to expectorate or get out. Inflammation of the mucous membranes, antimonium tart is a 3, Seneca. So you can, there's ropey, mucus secretions ropey. There's also so under generals, you can look at mucus secretions and then the type, how it's being described. You can also go to the expectoration chapter and do the same thing. There was another rubric I wanted to show you. Sit up and cough. There's a rubric, sit up must under cough. It'll have a Kunzli dot next to it. This means the patient can't lie down with their cough. They lie down, the cough gets so intense, so violent. Cough, sit up must. See these Kunzli dots here, the bryonia, conium, phosphorus, pulsatilla, sepia. These are all 53 of these remedies can present with this symptom. Sitting up in bed ameliorates. So they're lying down, doesn't matter if they're on the right side, left side, abdomen, back. And we have to differentiate those two. We don't just say, oh, lying down is worse. We have to ask them, is there a particular position? Is it worse on the right, worse on the left, lying on the right or left side, on the back? Because that might be the key to the case. You say, oh, if I lie down on my abdomen, I can breathe so much better, or I don't cough. So then you look up cough, lying. And here's lying down aggravates, but lying on abdomen Pneumonia, it's just 13 remedies. Metarinum is the main one. But all these other remedies. So we got to make sure we get really, really, really specific information. Okay. Don't want to spend too much time on the differential of all these, but for antimonium tartaricum, like I said, you want to do ipecac, lobelia, and some others. Whatever comes up with your repertorization, you definitely want to do a differential in the top 5 to 8 remedies. All right, case number 2. So this was a 34-year-old female. This was even further back, years and years, probably 20 years ago or more. She had a fever and a cough for 4 days. So the fever was about 99, and then the fever goes up while she's sleeping. So right around 99, 100, she goes to sleep. She wakes up and it's up around 102.5, 102. PO is by mouth. So that's a good symptom. So we go to fever. I believe it's sleep. Heat comes on, sleep during. So fever comes on during sleep. Right there. Burning of the soles with fever. So, and it has to be a strong symptom. Like, oh, ever since I've had this fever on my feet, I got to keep out of the bed or and if they say their feet, you have to ask, is it the whole foot or just the sole? And in this case, it's the sole. Weakness in the chest, which is worse from talking. You see how that's unique? The weakness of the chest, not something we'd repertorize this necessarily to get to a remedy, because we go to chest, weakness, 197 remedies. Okay. So not very useful. But if we go to weakness in the chest, talking aggravates. Now that's more unique, right? So we can use that. The other thing, I'll point this out here. I like to do this. So we have chest weakness, talking aggravates. We can also go to chest, just talking aggravates. What that's saying is that we have the part of the body, the chest, and we're not specifying what the talking is doing, but talking as a modality that aggravates a symptom. So we're not specifying the symptom, we're just saying the modality is very important here. And Boger really likes to do that. That's why you'll see Bonninghausen, Boger, Bonninghausen, Boger. BG is Boger, and B7, BE is Bonninghausen. So you can go to pretty much, let me just show you, let me just drag that in there. Let's just go to stomach. Talking aggravates. And you can see there's B4 Bonninghausen, B7 Bonninghausen. Fatakis they've added his in here as well, but he's in 1, 2 remedies he's confirmed, Helleboris and Rumex. But do you understand what I'm saying? Is that we can go to chest, you can go to pain, talking aggravates. So you've got some similar remedies, there'll be some overlap, but there's also some different remedies. So sometimes it's good to, let's just take this. So if somebody says, when I talk, it aggravates the pain in my chest, we can use this, but I would also recommend using the chest. Don't use pain, don't specify pain, but talking aggravates. There's 24 remedies, and I'm just going to put these in this clipboard down here. So see, pain has 20 remedies in it, talking aggravates has 24. And there's going to be a lot of overlap, but then you've got here, sulfur and bryonia are here, ammonium carbonicum, and Asclepius is there. So there are some differences. So what you would do here in this case is I would combine them. So click there, hold command, and then right click, go to group, and that'll cast your net a little bit wider. The 24 remedies in a rubric, if it's a strong symptom, that's something you can use and say, okay, I definitely want to look at the remedies that are in these 2 rubrics. So I combine them, and then you can continue to build your case from there. Okay. So weakness talking and then chest talking aggravates. So there's 13 there and 24 there. So we're going to combine those. Okay. So now we're looking at approximately 17 remedies. The curative remedy has to be in here. So burning in the soles with fever, weakness in the chest, worse talking loudly. Those are smaller rubric. We could use that. She happened to be quite lean person. Oh, the other thing I didn't put in here, she had a very greasy, kind of waxy complexion to her face. On auscultation and percussion, there were crepitation and rail. So these are noises in the upper left lobe. So we have a location. Dull percussive sounds. Percussion is when you take the two fingers and you put it over the chest, and then you tap on the knuckles here, and it'll give you particular sounds. So when the lungs are clear, it makes a certain noise, and you have to do it over and over and over again, and you'll look, okay, these lungs are clear, this area of the lung is clear. And then if there's hepatization, it'll sound a certain way. When there's consolidation, it'll sound a certain way. So the old medical doctors, period, and homeopathically trained medical doctors, their clinical physical diagnosis skills were head and shoulders above what people can do these days. There's so much reliance on technology, and imaging, and blood work, and all these chemical tests, and they're good, but what they could diagnose and what the information that they could extract, the picture they could paint just from clinical physical diagnosis was absolutely astounding. So dull percussive sounds over upper left lobe. So we can assume without an x-ray that it was the upper left lobe that was involved here in this case. And then this was kind of the key. This was what brought me to the remedy. She gets scared when in bed and calls for her husband just for company. Like she'll start crying and she'll call for him. He'll come in. He'll console her, kind of, lay down with her, put his arms around her, give her a hug. And what's scaring her? She thinks she's wasting away. So let's go to the face, greasy. Combine that with face, the greasy, waxy. The other one. It's very difficult to differentiate. So greasy, waxy group. So we haven't narrowed it down yet, but we're not up at 16, 17 remedies. We're down here. Let me show you percussion. Dull. Where would we find this? So we have all of this information, right? How do we search for it? How do we find it? Let's say you percussed all the lung fields and you find a dullness. So it's a dull sound of percussion. And in this case, it was, let me just put in the word lobe. That doesn't. And you're going to find this information in the. So let's put this over. Chest, lungs, percussion sounds, dull over upper part of the superior lobe. I'm just going to grab that and put that in there. Does anybody want to take a guess how to repertorize that last symptom that brought me to the remedy? I think she's wasting away. How do we find that? What does that mean? We can use the word wasting, right? But what are other synonyms that we might consider using? Emaciation, correct? Yeah. So there is thinning, emaciation, and wasting. I like those synonyms. So we want at least one of these. And I'm going to go just to the mind chapter because it's a delusion. And here it's a delusion that's strong enough that it causes her to cry. So it feels very real to her, right? If you have a case where the person says, oh, 6 months ago or a couple of years ago, I thought I saw a ghost. You're not going to use delusions of specters or apparitions or ghosts because it's not consistent enough. It has to be very consistent. And in this case, the feeling that she's wasting away is strong enough that, again, it's causing her to be afraid. So we want to get at least one of these, and we'll repertorize. We'll search in the repertories. So we've got delusions. Thin, delusions, body is thin. He's too thin with emaciation, like that one. Body is thin. Body's getting thin. And there's delusions of wasting away. Let's see here. Indifference with emaciation. That's not a delusion. Wasting time. Let's see what Murphy says. Sometimes there's a little variation. Delusions, generals. Body is thin, too thin. Visions of emaciation. Probably going to be the same remedies in there. Body is getting thin. So, oh, the soles of the feet during. So that's under. If I just clicked on the tab here, if I'm going too fast, you can always ask me to slow down. What do we have? We have heat in the feet during fever. So extremities, right? Where we're looking. Enter is heat in the feet during fever. Let's see if there's a soles during fever. During fever. There we go. So we'll bring that in there. So what do we have here? We've got heat comes on during sleep. Talking aggravates the chest. Greasy or waxy face. Percussion sounds dull over the upper part, superior part of the left lung, or the upper part of the lobe. This is not differentiating whether it's left or right, it's just the upper lung. So emaciation, we've got sulfur, natmir, thuya. Wasting away, there's nothing there that's coming up in the top 5 remedies. So we can, what I would do is command emaciation, emaciation, body's getting thin, thuya. Okay, combine those. Group, create a new rubric. So we have the soul burning in the soles of the feet during fever, and percussion of the upper lobes, and talking, we gave sulfur. Okay. So I actually, this was a long time ago, and I did a house call, and I did a constitutional hydrotherapy treatment, and I didn't have a computer at the time. I had a book. I had synthesis, and I was going back and forth between sulfur and lycopodium. It was the afternoon. I finished the hydrotherapy treatment, and I gave lycopodium first. And I said, if you're not feeling better by this evening, take a dose of sulfur 30C. So we repertorized. Sulfur 30C, 3 pellets once, and then as needed, no more than every 4 hours. So she took the lycopodium, didn't do anything. So then what happened? First dose around 9 p.m. She began weeping after about 30 minutes, just crying. And I think I see that as kind of just like a healing reaction, but just kind of letting go. And then she fell asleep. So 9 p.m., took the remedy, fell asleep around 9:45, 10 o'clock. She was still feverish, okay? Second dose, 5 a.m., around 7, she coughed up a large brownish red ball of mucus and blood. And shortly after, the fever broke. Like within 20 minutes, the fever broke. And then she just recovered, slow, gradual recovery over a period of about 2 or 3 days. And no more remedy was given or needed. So I've seen this a couple times when bacterial pneumonia, when you give a remedy, the body, the physiology changes to the point where the body can expel what's causing the inflammation. So those are 2 cases. This is how to repertorize. Oh, let me just go over a little bit of a differential. So differential for sulfur, you definitely want to differentiate chelidonium, kali carbonicum, ferrum phos, oleum gicoris, which is homeopathic cod liver oil. And you definitely want to do a differential of lycopodium and silica. I just want to show you sulfur is a big remedy for pneumonia. So let's just look up sulfur. And I want to look up, let's just look up pneumonia in lungs. Let's type in neglected. Make sure it's searching for each one of those individually in relationship to sulfur. All repertories. I've really learned to appreciate sulfur in respiratory cases. It's not always a skin case. Let's just take a look at Pulford real quick. So pneumonia left lower lobe, so sulfur. Pneumonia after abuse of aconite. People aren't, this is aconite, the herb, because aconite wolfsbane was used as an herb. It's a very toxic herb, but it was being used quite a bit 150 years ago. Pneumonia must lie on the back. Right? Sulfur, what's the other remedy here? Aconite. Lying on back ameliorates. Remember what I said earlier? You know, we don't just say, oh, lying down is better or worse. Is there a particular position on lying down? Pneumonia neglected. There's 7 remedies here. He's got lycopodium, silica, and sulfur, grade 3s. And it's really important to pay attention to the grading, okay? We don't want to forget the remedies that are grade 1s, right? That are just single or type like this, small type. They're not italicized, they're not bold, they're not underlined. But we don't want to forget those, but we want to pay attention to the remedies that are in red or bold or italics. Hepatization of the lungs. There's 10 remedies there. Sulfur, phosphorus, sanguinaria, lobelia. Don't forget lobelia. Lobelia is a big remedy for the lungs. Chest pain, cough during the after pneumonia. So this is the pneumonia is resolved, and there's still residual pain on coughing. Chest pain in the lungs. This is just location above the left nipple. So we can look there. Murphy's got 253 rubrics that you can go through. This is his clinical chapter. Cyanosis of the lungs, infants, empyema, this is pus in the lungs, pleural pneumonia. This is the pleura are the sac that covers the lungs. Neglected, it's a grade 3. Arsenicum iodatum. There's Seneca, and we talked about Seneca earlier. We can take a look at, so Murphy's got sulfur, 253 entries, and Schroyen's has Adonis 84. So anyway, this is just different ways that you can study materia medica. You can also, what we can do, you can just go and look at all references, and you can see what they actually said, because here his symptoms are what's in the materia medica is being turned into repertory language. And if you go to references, you'll see the actual materia medica, how it was. So let's see, Blackwood, useful during pneumonia when resolution is delayed. These are pneumonias where you get partial recovery and there's just, it lingers. Bulgur, oppression as if from a load after some food, feelings of the lungs touch the back. Very strange symptom. Suppuration of the lungs. Let's just take a look at Clark. He's got 13. Tuberculosis of the lungs. So this is sulfur. Acts on the whole respiratory tract from the nose to the lung tissue, as if lungs came into contact with the back. So you're seeing that come up. So as you're studying, you'll start to see that. Oh, so let's see if we can find that. What's the symptom? The lungs and the back. Lungs touch the back. Let's see who put this into their repertory. Let me check the repertory. So it's important not just to look in the repertory, but also look into the materia medica if you want to learn about a remedy, learn about its affinity for a particular condition. So inflammation of the lungs must lie on the back. Lying on the back, here it is, chest touch. So if you don't know how to put the words in proper order, you're not going to find this rubric. Chest touch. Most of you probably want to think the chest, lungs, or inflammation, lungs. So Bulgur has it. It's the only remedy. Back, as if the lungs touch the back and coughing. There's sulfur. You've got Herring, Hahnemann, Boninghausen, Allen. So this is a very, very strong symptom for sulfur, either when they're coughing or just in general, because if the lungs are touching the back. You can see what Murphy did. Inflammation of the lungs, pain, as if the lungs touch the back. Let me just see what Murr has. He usually has some pretty interesting rubrics. Cough before cough chest, as if the lungs came in contact with the back, and he puts it as a grade 3. Can only lie on the back, on the left side, on the back or the left side, not on the right. Sulfur. That's why it's also important to look in other repertories, because you might have something in nerve that they haven't entered into synthesis. And Ward is sensations as if the lungs touch the back. There's sulfur. Okay, so a lot of information to cover, a lot of information at your fingertips. Just continue practicing, navigating the repertory. There's so much information. You know, I've been doing this 22 years, and I still come across information that I didn't know was there. So there's just like a massive landscape of information, you know, over 200 years worth of clinical information that we learn how to navigate, learn how to use the repertorial or use the radar program. You can find the information quickly and efficiently. So I think that's it. So thank you for your time. I appreciate it. I hope you got something out of it. You know, the remedies are sulfur's common, right? Most common remedy, antimonium tartaricum. I think any of you who've been around or studied homeopathy, you know that antimonium tartaricum is a big remedy for weak, rattling cough. But it's interesting to kind of see the symptoms and kind of go through the process of turning it into repertorial language and how to find the correct rubrics, and then look at the remedies that are in those very specific rubrics. So hope you enjoyed the presentation, and I think I've got one more next month. So I did a series of 4. This is the 3rd one out of 4. So thank you very much, and you all have a good morning, afternoon, or evening. Over here it's evening. So you're welcome. Yeah, you're welcome. You're welcome. Okay, there's my contact information. If you need anything, any help, questions, or whatever, just let me know. And we are finished. So take care. Thank you, everybody.